in Lausanne, so where we had this project, we have a prospective cohort that include enrolled patients with a wide variety of CNS disorders, including inflammatory and non-inflammatory disease-suffering patients. So we dig into clinical data of this prospective cohort to dig out samples that may be related to any autoimmune disorders, including MS patients, of course, but also other patients suffering from paraneoplastic syndromes or autoimmune encephalitis, but also neuromyelitis optica spectrum disorder suffering patients. So a wide variety of patients. And we collected clinical data, radiological data, routine laboratory diagnosis data, etc. And we enrolled patients with defined autoimmune encephalitis, paraneoplastic syndrome, but with a known autoantibodies to validate our model. And we also enroll probable but not definite patients with symptoms that are highly susceptible to be linked with autoantibodies. And really, the first group of patients helped us in validating the process. And we are able to detect most of the antibodies that are detected in routine laboratory. And the second prospective cohort with probable autoimmune encephalitis suffering patient, seronegative NMOSD patient, MS patients, we go for new antigen, and we use this tool really to open to new antibodies recognized in these groups. And more specifically, so we are able to detect in the validation cohort most of the antibodies that were detected in routine laboratory. And regarding the exploratory cohorts, we can see that in probable autoimmune encephalitis or paraneoplastic syndrome suffering patients, we can detect up to 30% of autoantibody, recognizing either neurons or astrocytes. It's also the case in the seronegative NMOSD patients, so tested to be negative against known antigens such as AQP4 or MOG antibodies. In this patient, we are around 20% of the patient tested to date that has astrocytes or neuron-reactive antibodies. And last but not least, for the MS patients, we also detect antibodies targeting the two targets, either one or the other targets, I would say, in 8 to 12% of the patients to be tested to date. So here it opens perspective into digging into the immunopathogenesis underlying these complex diseases. And really, I think, to my point of view at least, is that we have really a unique tool that can help in opening new perspective in new antigen discovery.